The prevalence of tuberculosis in Zambia ranked amongst the highest in Africa, with an estimated 391 infections in every 100,000 people in 2015, according to the World Health Organization. In an effort to improve and strengthen the health sector's response to tuberculosis and occupational lung disease, the World Bank, the African Union Development Agency (NEPAD), and the East, Central and Southern Africa Health Community launched the Tuberculosis and Health System Support Project, otherwise known as the SATBHSS, in 2016. The SATBHSS is implemented in 4 Southern African Development Community or SADC member states, amongst which Zambia is included. 4 implementing agencies were involved in bringing the vision of the SATBHSS into fruition in Zambia, namely the Ministry of Health, the Ministry of Mines and Minerals Development, the Ministry of Labour and Social Security, and the Occupational Health and Safety Institute. The primary role of the Ministry of Health in this project was to implement TB prevention and treatment strategies from a community perspective.
Working together with the SATBHSS project within the country as well as in the region has been catalytic to the TB response. For instance, in 2016, prior to the commencement of this project, Zambia was only able to pick up 58% of the TB incident cases at that particular time. But throughout the life of this project, we have actually improved our case detection to now having a TB coverage of 85%, meaning of all the incident cases that are recorded in each year, we are now picking up at least 85%. Alongside that is that we have sustained a good treatment success rate for drug-susceptible TB at over 90%. Just to give you an example, last year we had a TB treatment success rate for drug-sensitive TB of 91%. Alongside that is that we have also increased our DRTB treatment success rate from just under 50% to now 76%. So this is how catalytic this project has been.
The SATB project needs to be strengthened with particular attention to occupational TB. Oftentimes, probably don't pay much attention to. TB starts from the place of work, comes into the community, into the hospital, and we need to know where this TB is starting from and get to there and get it stopped, because it's important to close the tap and deal with the water that is flowing out.
The Ministry of Mines was at the helm of the innovative prevention of TB and occupational lung diseases.
For the advent of the Southern Africa TB and Health Systems Support Project, the Mines Safety Department could only manage probably a maximum of 98 mining rights, and these basically are large-scale operations, meaning the small-scale operators, artisan operators and others were not accessible because of lack of financial resources, poor transport systems, and different lack of even dust sampling equipment and everything else. But when the project came on board, the project procured, I think, 4 Land Cruisers for the purpose of inspections, also made financial resources available for the same inspections. By the end, I think, of 2021, we had even reached 500 plus mines visited in the country. That was a tremendous improvement from the Pali, the 98 that were being taken care of before the project came on board.
The promotion and enforcement of occupational safety and health standards at places of work to ensure a safe and healthy working environment forms a crucial part of the objectives of the Ministry of Labour and Social Security. This in turn formed the basis for their role in the SATBHSS project.
Previously, the Workers' Compensation Act, the way it was crafted, caused workers not to, disclose their status, because the way it was sitting is that once an examination is found that there's a positive TB in workers, then it might cause the employer to, lay off because of the status. Now that there was that realization, I think there was need to change the law, and there was that realization, and the process of reviewing the act commenced. Through the funds that we received, we were able to start the process of review, but of course kickstarting the guidelines under the Workers' Compensation Act that really assisted. Right now we have advanced in the review of the Act at an advanced stage now.
One of the functions of the Occupational Health and Safety Institute is to ensure the safety and well-being of persons at work. Their role in the SATBHSS project was consistent with their mandate.
The Institute has achieved a number of positives, and among those positives, it's the skills development in ILO classification of radiographs of pneumoconiosis. Now, from the time we started this training, and from the time we also started using the digital X-ray equipment, we have recorded an increase in case detection of occupational lung diseases. To be specific, there is an increase of about 34%. We've offered OSH services to almost 10,000 clients. So that's another achievement under the project in terms of medical surveillance. The officers on outreach programs, they're able to access the medical records of the employees right from the stations where they are operating from. So that itself has reduced the processing time of reports. So currently we are able to issue reports for outreach centers within a week. Before that, it used to take us almost a month to issue the reports. So that's another achievement under the project.
The improved diagnostic capacity and skills has been facilitated by NEPAD when they embarked on skills training for the occupational hygiene practitioners, which has been translated to an ability to detect and quantify occupational hazards, which in the past we would not have been able to identify and quantify. The equipment which has been bought has helped us to detect these occupational hazards, which helps us in medical surveillance and mitigation and prevention and controls for the workers.
The impact in terms of the project is that we've seen now a better collaboration on all the institutions and ministries that are focusing on occupational health. We have systems that have been put in place. Now we can tell how many mines are there and when they'll be inspected, and we know how many staff are there, but we also know in terms of the dust levels in each mine and how they are complying. We also are able to tell how many miners are being examined every year, how many are being found with tuberculosis and silicosis, and how many are being compensated.
I would like to express my sincere gratitude and appreciation to the SATBHSS project for enabling us achieve all these great milestones under this project. Without AUDA-NEPAD with their technical support and the financial support coming from the SATBHSS project, we may not have achieved these great milestones. So again, I would like to say thank you, the SATBHSS project and the World Bank for having financed this great project. Thank you.